Hello, I'm Dr. Puya Mahajer and I'm the Director of Spine Intervention here at Cellaxys. Today's topic is what to expect if epidural steroid injections do not work. Millions of Americans suffer from some sort of back pain on a regular basis. When the pain is too much to bear or if the pain is impacting daily activities, it's time to see a medical professional. There are many treatments available for back pain. Some of the more common treatments include posture correction, medication, physical therapy. Another treatment for chronic pain is corticosteroid injections. Some of the questions that people have is, what are epidural steroid injections? The epidural space is an anatomic space within the spinal column. It contains veins, nerve roots, fat, and connective tissue. The purpose of the epidural space is to protect these structures. It also provides extra room for the spine to move around and absorb shock. The space surrounding the spine is meant for protection, but the tissue can also become inflamed and place stress on the nerves. Compressed nerves can lead to pain in the back, pain or numbness in the extremities, and a tingling sensation depending on where the compression has occurred. Cortisol is a hormone that is released naturally by the body. Blood sugar levels, inflammation, and metabolism can all be affected by cortisol levels. Epidural steroid injections contain a synthetic form of cortisol called corticosteroids. Increased amount of cortisol can reduce swelling and therefore pain associated with the injury. Conditions that may be treated with epidural steroid injections include, but have not been limited to, spinal stenosis. This condition is when the spinal canal narrows and creates pressure on the nerves and the spinal cord itself. This may result in pain, numbness, tingling, or a sensation of weakness. Another treatment option includes herniated or slipped discs. Discs are a piece of cartilage that exists between the bony vertebrae in the spine. Discs work to absorb shock and help with flexibility. They also reduce the likelihood that the bones will rub against one another. The soft inner part of the disc can leak out of the disc, causing pain and discomfort. Another condition that can be treated is called spondylolisthesis. This is basically when the vertebrae slips out of place, which may in turn apply pressure on the spinal canal. This condition may cause pain and other nerve-related symptoms such as tingling or numbness. Bone spurs. These are basically extra growths on bones that may lead to pain and inflammation. What are some of the risks associated with epidural steroid injections? Epidural steroid injections are generally considered safe, which is why they have been used to treat pain for decades. However, as with any procedure, there's always risks and side effects involved. Some of the most common side effects of steroids include your elevation of the blood sugar levels, irritability, restlessness, anxiety, headaches. Excessive use can lead to soft tissue damage, bone destruction, and thinning of the lining of the stomach. Alternative treatments for back pain include reducing pain can lead to more involved physical therapy, greater enjoyment of life, and ability to return to tasks that were impossible previously. This is why many doctors following the conventional path focus on pain relief. There may be an option that offers not only pain relief but the treatment of the underlying condition as well. The field of regenerative medicine seeks to use the body's own natural occurring healing cells to enhance the recovery process. Here at Cellaxys, we offer two types of regenerative therapy. The first is mesenchymal stem cells. Mesenchymal stem cells have the ability to help cells repair and regenerate once they have been damaged. The cells are procured from your bone marrow. The cells are then processed and injected into the area where the pain is located. The second therapy is called platelet-rich plasma therapy, PRP. Platelets contain proteins and healing factors that can reduce inflammation and call to other healing cells, such as mesenchymal stem cells. The procedure of receiving PRP therapy is similar to that of mesenchymal stem cells. Once the blood is drawn from the patient, it is placed in a centrifuge that helps concentrate the platelets. The solution is then injected into the problem area. Both forms of regenerative medicine involve outpatient appointments that take under 2 hours. The most common side effect is some pain around the injection site. As these treatments are utilizing patient's own cells, the risk of rejection, allergic reaction, and other adverse effects is significantly reduced. Ultrasound or live X-ray, such as fluoroscopy, is used to locate the exact point where the needle should be placed. These therapies have seen significantly positive results and continue to be a viable option for chronic sufferers. Unlike some conventional treatment methods, regenerative medicine seeks to reduce and simultaneously treat the underlying cause. Some patients are even able to avoid surgery or other invasive treatment methods. In conclusion, back pain is one of the most common chronic conditions in the United States. Most adults have experienced some sort of back pain in their lifetime, leading to a vast array of treatments and remedies. Some conditions can heal on their own with home treatments which may not work. Conventional treatments have been helping patients for decades but may come with unforeseen complications. For this reason, it is important to talk to a doctor about what is the best option to meet your individual needs. When deciding on a treatment plan, some patients benefit from considering a wider array of treatment options outside the conventional path. Schedule an initial consult to see what options are available. Thank you for watching this video, and I hope this was informative. Thank you.